Hello, I'm Laurence. I'm a consultant dermatologist. I have spent the last 25 years working as a dermatologist in the NHS and in private practice. These days I do virtually all private practice. It's nice to be able to see patients with enough time to deal with their problems. By listening to what people have got to tell us, by examining them carefully, we can understand what's causing their problem and then work out what to do to put things right for them. I particularly enjoy working at 108 Harley Street because we have a nice team of doctors around us, plastic surgeons, oncologists, general surgeons, as well as other dermatologists. We like to see patients with a whole range of different dermatology problems, so we see patients right down to the age of 12, and we're very much geared to trying to understand the causes of people's skin problems and then finding a solution for them. So the important part of being a dermatologist is to listen to the patient, to understand what the problem is, obviously then examine them and hopefully find a solution that works quickly and effectively for them. There are some conditions that obviously require longer term follow-up. There are some conditions which we would call chronic. They go on for a long time, and so those individuals do need to see a doctor at intervals over a prolonged period. But the beauty of working here is that you will always get to see the same doctor on a repeated basis, and I think that's one of the problems that sometimes people have with their GP surgeries. They have lots of different doctors and everyone's very busy, so they tend to see a different doctor each time, so that continuity is something that we like to offer. We see a lot of patients with skin cancers or suspected skin cancers, and that often requires minor surgery, removing little bits of skin either for testing or as a treatment. So it's great that we've got our own dedicated operating theatre here within the building, so patients can come along and then together with the nurses we will do the treatment that's needed. Sometimes on the first day that they come, but sometimes people want to come back and have their treatment on another occasion. We have access to top quality pathology labs, so bits of skin tissue which have to be tested are sent to our own pathologists that we work closely with. We have blood testing laboratories very close by, so it means that there's no delay in getting tests and results there. We're very lucky that we have a good team of nurses who support us in the clinics, and that's important because often patients feel a little bit nervous and it's nice for them to have someone to chat to maybe before their appointment or afterwards. If they've forgotten something the doctor said, the nurses can have a chat with them afterwards, and of course if they phone up during the week, if the doctor's not around, then the nurses usually can give them some background or answer any questions. So that's a really helpful part of working here as far as I'm concerned. One of the good things about working at 108 Harley Street is that we know that all of the doctors that are working here are accredited specialists, so that's not always the case. So I always recommend that patients should check that their consultant is on the specialist register, because unfortunately there are quite a lot of doctors practicing privately who may not be quite as qualified as they claim to be. So it's always worth checking on that.